Greetings, welcome back to ERMP and Beyond, the pulse of clinical medicine. Join the channel as we tackle real-world medical cases, enhance our knowledge, and refine our skills with evidence-based practices. Get ready to unravel today's medical mystery with us. So, without any delay, let's dive into the depths of today's medical case discussion. A 48-year-old male known type 2 diabetes mellitus patient, taking metformin 1000 mg POBID, came for regular follow-up to your clinic. His blood pressure is 125 by 80 mm mercury, and has good glycemic control. What do you want to add for primary prevention of arteriosclerotic cardiovascular disease in this patient? A. Aspirin. B. Statin. C. Insulin. D. Antihypertension. Today, I'd like to share a case that exemplifies the success of diligent diabetes management. We have a 48-year-old male patient with a known history of type 2 diabetes mellitus. He has been on a consistent regimen of metformin, 1000 mg taken orally twice a day. His adherence to this treatment has been commendable. During his regular follow-up at our clinic, we noted that his blood pressure was well-maintained on 125 by 80 mm mercury, indicating excellent cardiovascular management in conjunction with his diabetes treatment. Furthermore, his glycemic control is within the desired range, a testament to his commitment to managing his condition and the effectiveness of his current medication plan. The consideration for primary prevention of arteriosclerotic cardiovascular disease should be multifaceted. The American Diabetes Association, in conjunction with the American Heart Association, emphasizes the importance of a comprehensive approach that includes lifestyle management and pharmacotherapy tailored to individual risk profiles. For patients like the one described, who are already on metformin and have good glycemic control, additional considerations could include the management of other cardiovascular risk factors, such as dyslipidemia and hypertension. Current guidelines suggest that statin therapy is the first-line treatment for primary prevention of arteriosclerotic cardiovascular disease in patients with diabetes who are between 40 to 75 years of age, especially if they have additional risk factors. Given the patient's age and diabetic status, a statin could be considered to manage LDL cholesterol levels effectively. Moreover, the 2019 American College of Cardiology and the American Heart Association guidelines on primary prevention of cardiovascular disease recommend a patient-physician shared decision-making approach, taking into account the patient's values and preferences, potential for benefit, and risks associated with the intervention. In addition to pharmacotherapy, lifestyle modifications remain a cornerstone of arteriosclerotic cardiovascular disease prevention. This includes dietary changes, regular physical activity, smoking cessation if applicable, and weight management. The guidelines also highlight the role of newer glucose-lowering agents such as sodium glucose cotransporter 2 inhibitors, and glucagon-like peptide 1 receptor agonists, which have shown benefits in cardiovascular outcomes in patients with type 2 diabetes. We have discussed about the sodium glucose cotransporter 2 inhibitors in case number 21. The link to the video is given in the description below. It is also important to consider the patient's entire clinical picture, including family history, and other potential risk factors that may not be immediately apparent. Regular monitoring and reassessment of cardiovascular risk are crucial for ongoing management. Ultimately, the addition of any pharmacological agent or lifestyle modification should be a shared decision between the patient and the healthcare provider, ensuring that the chosen strategy aligns with the patient's health goals and is sustainable in the long term. Option A, aspirin, is not the primary choice for arteriosclerotic cardiovascular disease prevention in this patient. Aspirin is an antiplatelet agent that can reduce the risk of clot formation, which is beneficial in secondary prevention, where there is a history of cardiovascular events. However, for primary prevention, its use is more nuanced and is generally considered when the patient has a higher risk of cardiovascular events. The current guidelines suggest that aspirin should be used selectively for primary prevention in patients with diabetes who have a high cardiovascular risk and are not at increased risk for bleeding. Option B, statin, is the recommended addition for primary prevention of arteriosclerotic cardiovascular disease in patients with diabetes. Statins are lipid-lowering medications that reduce levels of LDL cholesterol and have been shown to decrease the risk of cardiovascular events in patients with diabetes, even in those with normal LDL cholesterol levels. Given the patient's age and diabetes status, a statin would be appropriate to reduce the risk of first cardiovascular events. Option C, insulin, is not indicated for primary prevention of arteriosclerotic cardiovascular disease. Insulin is a cornerstone treatment for glycemic control in diabetes but does not directly prevent arteriosclerotic cardiovascular disease. It is used when oral medications are insufficient to maintain glycemic control or in specific situations like type 1 diabetes or during hospitalization. Option D, antihypertension medication, would not be added at this time since the patient's blood pressure is currently well controlled at 125 by 80 mm mercury. Antihypertensive medications are used to manage high blood pressure, which is a significant risk factor for arteriosclerotic cardiovascular disease. However, since this patient's blood pressure is within the target range, there is no indication to initiate such therapy for arteriosclerotic cardiovascular disease prevention at this moment. It's been a pleasure sharing insights on today's important topic with you. Your understanding is my top priority, and I trust this session has broadened your knowledge. Don't miss out on future discussions by subscribing. Your feedback is invaluable. Please like, comment, and share your thoughts on how to further enrich your learning experience. Together, let's continue this journey of discovery and improvement. Thank you for engaging with today's content.